The good bit is just to sit around and to listen to the stories of all the initiatives around the globe, and to get a sense of what everybody's up to, and also draw lessons from that, and connect and socialize with all these different parties that are present at the conference, and to hear what is also the overall strategic direction that the field is taking. Every so many years, there is also a bit of a pivot in the approach to value-based healthcare and related topics. And it's simply a super easy way to get insights into the latest and greatest ideas of the community. Yeah, so LOGEX is a European healthcare data and analytics company. We have a lot of local strong roots in various countries around the continent. And our aim is to help optimize healthcare and to resolve the troubled waters that the sector is always operating in. We are spread across roughly 11 countries with roughly 400 plus colleagues in the different domains that we are active in. We help about 1,000 different public and private healthcare providers across Europe. And we help them with three types of questions or challenges around financial analytics, patient engagement, and real-world data or real-world evidence. Financial analytics is mostly focused on operational and financial control. So how do we help hospitals to find the answer around how much does a certain intervention cost, what are patient volumes going to do, and how will that impact our budget in the years to come. Patient engagement is mostly focused around measuring outcomes that matter to patients, and this is also our tie to iCHOM, of course. And we use that to add the quality view to these financial data sets that we just spoke about. And last but not least, we have a group of colleagues active in the world of real-world data or real-world evidence, mostly with large institutions that are not-for-profit or institutions like pharma companies that want to answer the most challenging questions around their products or their ideas or their interventions, and how to improve them from either a cost volume perspective or a patient outcome perspective. The big why question. I think what we offer is a pretty unique, or at least extensive body of know-how, experience, skilled people around this challenge of what we call optimizing healthcare. And we help clients to make the right decision when balancing outcomes, mostly patient outcomes, with the costs of treatments that are being considered. What we see is that healthcare demand is only growing, whilst our human resources are in trouble or dwindling, and financial means are always limited. And this makes the healthcare policy decision-making process very tricky. It's super sensitive. It's a balancing act of affordability on the one hand, accessibility on the other, and quality expressed as patient outcomes as a third dimension. And that's not always easy. It's changing all the time, how these factors interact. And in the meantime, we expect healthcare professionals to make decisions that impact the life of patients for real. It's not a desktop exercise. It's a real set of decisions that they have to make, which makes it super hard and also challenging, but also, of course, a very rewarding sector. And what we want to do, and the impact that we bring, is that we want to help this process with the right tooling or software and know-how around it to identify data sets that they have, to capture new ones if they need be, and to weave these into insightful dashboards or decision-making processes that will help professionals and patients in the treatment room, to help healthcare provider organization boards or board of directors to make the right calls, and any other stakeholder in the healthcare community, such as government and pharma, to make the right call. And we have many different impact stories that you can read on our website, of course. You can pick a few. So in the UK, P9 healthcare, we help to come up with a way to use patient-level costing insights at the individual level. For PE, we created a breast cancer app, native app, that educates patients on the super complicated track around breast cancer care and keep track of their outcomes in the process. And in the real-world data space, we did a very large-scale study around lung cancer that actually found out that, maybe just put in simple terms, that reducing the level of medication actually improved quality of life of patients, while also not impacting the actual outcome when you speak about survival rates, and pressing down costs because there was less of the medication needed. So these are just a few examples of the impact stories you can find on our website. So the patient engagement unit of LOGEX is around to ensure that the patient perspective or the patient outcome part of the value-based healthcare formula is covered. And so we help to find data that is already present in EMR systems. We try to integrate with those and to draw that data set in and to use that also to enrich and also partly automate the collection of patient-reported outcome measures in normal daily operations around clinics. So patient engagement works for hospitals, actually only for hospitals or groups of hospitals involved in a national quality registry or an international pharma project. And we operate as the trusted intermediary party that helps hospitals to collect the patient data, to enrich it with data that already sits in their EMR system, and to derive the insights that those data sets bring with dashboards for quality managers, for board of directors, but last but not least also for healthcare professionals that sit in the treatment room and have a debate with the patient on what is the best next step in their treatment. And of course, we want to be able to help that professional to guide that decision-making process with the patient based on real evidence, on patient-reported outcome measures that have been reported by patients like the patient that is sitting in the room at that moment in time, so that they can have a evidence-based set or expectation around the recovery process on very simple or very humane topics like fatigue and pain and sleep and being able to go to your work every day or being able to go to the grocery store by yourself. That's what patient-reported outcome measures is all about and patient engagement is all about. Next to the fairly simple measurement of patient-reported experience measures or experiences that patients have when they go through the healthcare system. And patient engagement provides those tools. So LOGEX Patient Engagement provides those tools, and we help hospitals to collect those data sets and to participate in this larger debate or larger evaluation of what is actually sensible care, what is care that helps patients to improve their lives, and can we somehow also attach that to the insights from our financial analytics colleagues that can tell us something about the costs involved in improving the quality of life of patients, and to start to make this real value-based healthcare assessment, saying what is the quality adjusted life year that we won versus the cost that we spent on this patient track, and do we feel that is a good balance that we're striking? Is it actually value-based healthcare? So the role of ICHOM, in my view, or at least as I have experienced it, is that it can bring together the best minds and also the motivation of various stakeholders around the continent or the globe actually, to settle the issue of how to measure quality of care or outcome of care. Because simply settling that discussion with every stakeholder involved, patients, professionals, healthcare organizations, various institutions around the planet, is no small feat. And having that consensus is extremely important to get any project off the ground. And we've noticed that oftentimes in big projects around a nation or multiple regions or across nations is even worse. That simply agreeing on how to measure is one of the biggest hurdles to get the project off the ground. And iTROM helps with that, and that is something we greatly appreciate. It helps us also to kind of delegate that decision-making process to this group of people. Secondly, I think iTROM organizes a great conference every year in a different city, where you can meet with all these different players in the field and exchange know-how, experiences, tips and tricks, to see what has already been done and what has not been done yet, and to talk about that. It's a fun event. It's also a very educational event. And if you just sit around and listen, you also get a good view or vibe of what the overall community around the globe is up to, and that is super useful. And I think last but not least, there's a lot of initiatives going around on measuring outcomes and quality around the globe, and iTROM is also a way to kind of give that a stamp of approval that it has been done in a thorough way, with considering all the different angles of this very challenging topic. And yeah, that's good. We are grateful for being part of the community. Colleague Fabio Catrinella, our medical lead, long-term enthusiast also in the value-based healthcare field, even before it was called a value-based healthcare, is the PROMS How to Walk Talk session that is happening on Tuesday the 22nd at 1:30. And we will reflect on how we implement PROMS measurement in your clinic, how we make it part of the process, integrate it into your IT systems, and help you also train healthcare professionals to use PROMS when facing the patient and making it relevant to them in day-to-day healthcare. Looking forward to seeing you all.